Welcome. Hello, everyone. This is Dr. Christopher Gay. I am here today with exciting technology that is newly available in Alaska, coming very soon. You have to sign up. We'll give you information at the end, but I have Molly Reque. She's here with energy-based wellness, and she's talking about the Scrambler therapy. This is something for neuropathy, neuropathic pain. This is a pain that bothers a lot of people, and it's hard to treat, especially if it's from certain sources such as radiation induced or chemotherapy induced. There's not a lot of things that we're allowed to do or can do from the perspective from which I work. And that's doing injections, nerve blocks, stimulators, and things like that. Molly's been on both sides of the curtain. So she's been on the surgical side doing neurosurgical surgeries and procedures. And so she'll tell you a little bit more about this technology, which I'm excited about. I've actually looked at it in the past. So I'm glad she's bringing it here, and I'm glad to be working on it with her. So, Molly, welcome. Tell us a little bit about you and tell us what your why is for starting energy inspired wellness and what brought you to get involved with Scrambler therapy.
Well, thank you, Dr. Gay, for that introduction. I appreciate being here and I'm excited. So, my name again is Molly Reque. I'm a physician assistant. I'm actually living in Eagle River, been there for the last 12 years in Alaska. And so, my background is in medicine, starting in the military as active duty, as a ground medic, flight medic, and then PA, and still continue with my guard duties. And then also working now on the civilian sector as a PA. I've worked in neurosurgery, as he mentioned. I was actually Dr. Bernard's PA, his first assist, until his retirement. And many of you know Dr. Bernard. And that's actually how I met Dr. Gay. So that was a great alliance.
And he's the reason I'm in Alaska too. So he's a great surgeon, great person, and I think it's wonderful that we've met. So I didn't mean to interrupt you. Go ahead and tell us about what inspired you to start energy inspired wellness.
Yes, absolutely. So energy inspired wellness, I actually started it last October with it was an IV hydration clinic to begin with. So it was actually energy inspired drips, IV hydration, and wellness. And what my goal all along was to expand into whole body wellness. That's where my passion is. That's what I believe in, as a person as a whole with many different entities that needs to be addressed. Starting primarily with helping people get out of pain. My primary mission is to help people get out of pain, get the pain resolution or near resolution so they can embrace their best life. And that includes, people with chronic neuropathic pain, primarily what the Scrambler therapy is going to be used for. So yeah, I started this back in October and have now expanded into introducing the Scrambler therapy, which we'll talk about here in a few minutes, but I'm excited. I think this is going to be a great treatment plan for a treatment option for patients who have failed multiple other therapies, who continue to live in pain. They're overshadowed. They're just in this pain hell day to day, and they need a way out. And this is going to be available to treat them, and I am excited.
Absolutely, absolutely. So as you might imagine, you just read the list. These patients have tried many things. They've tried medications. They've tried physical therapy. They've tried injections. They've tried surgery. They've tried implanted devices in the body. Many of them still have pain. So many of them may be a little skeptical and wondering, hey, this new device, is it really going to work? The odds are probably not. So tell us a little bit about the effectiveness of this Scrambler therapy to kind of put it in perspective of how many people improve and what types of people are going to improve from this.
Yeah, that's a great point to talk about. So, chronic pain affects 100 million people in the U.S. The U.S. alone. That's not including any other countries. 635 billion dollars are spent on pain management and lost, time. So it's a huge crisis, an epidemic. It is growing, and life is too short to be, continuing this realm. So we've got to do something about it. So Scrambler therapy it's a non-invasive, non-medicinal, non-surgical treatment that, very simply put, redesignates a non-pain signal to people who have pain regions and propagates this non-pain signal, replacing a pain signal, and leads them to effective long-term pain treatment. It's usually given over a sequence of about 10 sessions, really implementing nerve memory in the specific nerve fibers that the Scrambler treats. And people have been seeing upwards of 80%, some 100% of pain resolution, primarily again for the neuropathic type of pain. We're talking about chemo-induced neuropathy, diabetic neuropathy, alcohol neuropathies, CRPS, hepatic neuralgia, a lot of these types of pains. This is what Scrambler therapy is effective at treating. And it's very simple. People, it's electrode sequencing device that's in the clinic itself. People get the little electrode pads put on, kind of like when you get an EKG at your doctor's office. And the stimulation of the electric activity redesignates the signal over time, over sequences of appointments, and helps that patient really understand and feel what living without pain is like, and then perpetuates that signal forward.
Right. Let me just summarize for our listeners just to make sure they understand it. So there's nothing implanted in the body. There's nothing that stays in the body, correct?
Correct.
Correct. And this is something that is going to essentially take over those train tracks that are delivering pain back and forth from the brain to the periphery, to the limbs and everything. So it's not sending pain anymore. This is going to load up those trains with something else. So the body does not sense pain. Again, and this is type of pain that's not protective pain, right? If you cut yourself or break a bone, that's protective pain, so you don't do it again. But this is a chronic pain that's just developed because the nerves have some type of problem or they've been damaged and they can't recover from that in the current sense. A lot of times, if you don't, they say use it or lose it. If these nerves don't continue to be used, sometimes the burning and stuff will stop, but you have just perpetual numbness. And so this regenerates these nerves, it sounds like, by sending signals through those nerves that are kind of more normal and get them to do their job, transmitting these signals and not just slowly dying, right?
Yes, absolutely. Yeah. And that's, great that you pointed out. It's that burning pain that affects, like, especially primarily the limbs, like the hands, the feet, again, some along the course itself, but it's that burning, searing pain that people live with, but it puts them in agony day after day. So that's what it really, really helps resolve. And that's the goal of the Scrambler therapy.
Wonderful. And so just to, again, for the benefit of our listeners, can you list several conditions, maybe diabetic neuropathy, radiation induced, that would do well with this? And if there's any that are unexpected conditions that might do well with this, what would you say?
Yes, primarily we're going to be looking for people who have lived with chemo-induced neuropathy of their hands and feet.
Hard to treat.
Very hard to treat, and now if even if their cancer is being treated and maybe even in remission, they're dealing with this for the rest of their life, and this is just overshadowing their balance and their quality of life. And so that's great for that type of pain, as well as your diabetic neuropathy. So diabetes is a huge epidemic especially in the US, and is only increasing. And the fallout of that is you're dealing with the hands and the feet, these searing pain, pins and needles, sensitivity or non-sensitivity. And that's just something, especially if you get your diabetes under control, to still deal with that, you want to get that pain taken away. Also, CRPS, very, very difficult to treat. People stay on long-term medications, pain medications that take over control of their life, and they still deal with breakthrough pain. This treatment therapy has proven to be very, very good for that type of pain, as well as things like endometriosis, hepatic neuralgia, that sensitivity that people get around, especially there along the rib cage when you get a case of shingles. That's just, no one wants to live with the sensitivity of their clothes just causing searing pain. So this has been proven to be very effective for treating that.
Sure. What was interesting to me in studying this technology is that it is another option, even for patients that have, traditionally we would say they've tried everything. They've tried a spinal cord stimulator and they don't have relief. This even can work in those situations, which is great. And what was really even more exciting is that they can tell from the first session that they're getting some relief. It's not that you have to do all 10 and then maybe you'll feel better 6 months later. Right away that this is going to help you. And so that was exciting to me. I'm sure you're excited by that as well. I understand you're having a grand opening, on August 5th through the 8th. Well, the first week in August, right? First full week in August. And so we'll be there kind of working with you on that. And so we'll probably want to get some patients in for that. So I think you're going to talk more about anything that will make it more enticing for them to try besides just having pain relief, which should be enough by itself. But just tell me again, patients that might have some fears. What you described the procedure, and that was great. And so, what other things might patients be concerned with this type of technology or therapy? What have you heard that are concerns for patients?
Absolutely, yes. So again, Scrambler therapy is there for especially primarily for people who have failed treatments, and they might be cautious and fearful of trying another one that might fail again. But the beautiful and the real way that Scrambler therapy sets itself apart is patients who we put the electrodes on, we start the Scrambler sequencing, they know within the first 5 to 15 minutes if their pain is resolved because we find those spots on the body that redirect or rescramble the pain signal to a non-pain signal. They know right away my pain is gone. That tells us right then and there that they are a prime candidate, that this is going to be effective for them. And it will take time. Over a sequence of about 10 to 12 sessions per patient is where we really see the nerves having enough memory. Just like muscle memory, you have to go repetitively to the gym, you have to lift weights to have that muscle memory. Nerves need the same thing. So repetitive therapy sessions, about 10 is where the average is people see. And if they have pain relief for over 48 hours, we consider them completed, graduated, no longer needing this. Now, some patients, like CRPS patients who have really, really traumatic injury to their nerves, may take an occasional longer session or a booster every month or every couple of months just to keep their pain where that we consider it relieved. But that's kind of how it works. They'll come to the office. We'll have a free one-on-one consult to make sure that they're a candidate, review their medical history, and just answer any questions, any fears, and just show them the machine, show them what they're going to be going through. Then we'll make sure that all the consent forms are signed at that time. And then usually right then there, we can schedule you for your first session if you're a candidate, and we'll get you started with your life without life with reduced or maybe completely resolved pain. That's the goal, of course.
Right. And just to clarify, you mentioned if the pain is gone for 48 hours, that means and continuously gone, not gone 48 and come back. They're not great. You had pain relief for 2 days, you're done. That's not the goal, right?
Right, that is correct. You're right. And most people see the first session lasts for maybe an hour or two, a couple hours. They're like, wow, my pain's so much relieved. And then it starts to creep back because those nerves don't have enough memory. Then the next day we go through, each session is about 30 minutes. They sit with the stimulator on, but the first 30 minutes, we're just finding the right spots to put the stimulator. So each day, the duration of pain relief lasts longer and longer till when it does eventually reach that 48-hour mark of I've gone 48 hours without pain, which is again usually about session 10. Then we consider them completed and the treatment complete, and then we can step into the next realm of our treatment package.
Right. And I love that analogy, like going to the gym. I wish I could go and lift weights one day and be good for the rest of my life, but you have to continue doing it for a while to get the muscle memory. So that's great. So patients can do that. Now, again, another concern might be financial, right? Like, do I want to commit to this? Is there anything you might do for early adopters to kind of, incentivize them for coming out and trying this? You got the grand opening coming up. So anything along those lines that might allay some of those financial concerns?
Absolutely, yes. We want to make this affordable. Again, our primary mission at Energy Inspired Wellness is to help people feel better, and that includes providing this treatment for whoever wants it, whoever needs it, whoever wants to have a better, more healthier life. And so we want to make it affordable. We are doing in lieu of our for our grand opening, we will be doing a very, very phenomenal special for the first 12 people that sign up. We will be doing a discount for the first session. The first session, you don't even pay if you don't have relief. Like that, let's make that clear. You don't pay if you don't get the relief. It's very few that people don't get relief in that first session, but if you don't, then your money back. You don't pay. But we will be doing a phenomenal discount of well, it's over 50% off for the first 12 people that sign up. And then from there, we'll be having great discounts just along the way to make this affordable. And yet we want to show the effectiveness and that this is saving you money in the long run for hundreds of thousands of dollars people spend on pain medications that maybe don't have lasting treatment. You have to take them every day. This is a solution that brings you lasting, effective treatment over a session of maybe 10 appointments.
That's amazing. So, again, just to recap, we have a procedure that does not require any needles, any surgery, any stitches, anything other than like going to get an EKG, a little sticker on you. And the session's about an hour or two or something like that, I believe. And it may give pain relief that can last pretty much indefinitely after they have the full sessions, and all for a set price that's not necessarily along the lines of what it costs to get a surgery or have stimulators, or even, even the copays for physical therapy can add up, or medications can add up. So it sounds like it's something where the results are priceless, even though you're giving them a discount. And even better, you give them a money back guarantee for that first session. So this is very exciting. Again, there's some very difficult pains out there that this device is proven to treat. And so I think hopefully we'll have a link, and we'll have people be able to sign up and connect with you directly to come in and experience this therapy. And again, I'm excited to be working with you on it. So
and just to really put that out there for everyone and make sure they understand that this is we're looking for people who really want to feel better, get better, and the first 12 people that you sign up, you will be getting a phenomenal discount, again, greater than 50%, and that first session for everyone, whether you're the first 12 or you're the 130th, you will be getting that first session money back guaranteed if we don't see the results that we want, meaning you don't feel some pain resolution. Again, it doesn't last, but it will show you that we will get there through trial of continued sessions. So just make sure people know that this isn't something they're going to pay up front for and then be out of loss. This isn't another failed service. This is going to be something that's going to provide you the treatment, or if it doesn't work, which is very rare, then we'll know in that first session.
So it's not just take my word for it's going to work. The proof will be in the pudding at that first session. That's very exciting. Lovely that this option is available, and again, that you did the groundwork to bring it to Alaska, and that you connected with me on it, because certainly I have patients that have neuropathic pain, and maybe they've tried stimulators and things, maybe they haven't. There's some patients that don't want things in their body, and that makes perfect sense to me. Everybody has their own different decisions and things that they want to do or will not do, and this is an option for people that absolutely don't want device implanted in their body, prefer not to have any injections, and it's a a series of treatments that can lead to long-term pain relief without having to make these at times life-changing or life-altering surgical or medical decisions. So I know you briefly described it earlier, but let's say I just walked in your office, I'm one of the 12 that signed up, first 12. What do I expect from the time I hit the office to the time I leave? What is that experience going to be like? What should I wear? Just tell me what.
Yeah, absolutely. Oh, that's great. Great question. So yeah, let's just take you're my patient. You come in, you heard about Scrambler. You're like, is this going to work for me? I've had this pain. We're going to first discuss what kind of pain you're experiencing, because there are different types of pain. We want to make sure that you have the best outcome possible. So we want to make sure you have the appropriate pain that Scrambler therapy can treat. Once we've established that, we'll do a brief medical history to make sure there's a few contradictory things that we want to make sure aren't in the way, like implantable, defibrillator device or anything like that. We do want to see what kind of pain medications you're on. There are a few pain medications like gabapentin that we're going to want to wean you off a little bit before you actually have your first session.
Because it can affect nerve response, right?
It can. It slows it down. Even things like muscle relaxers will slow down the effectiveness of the Scrambler, either in requiring more sessions or not being as effective in showing us where to locate the pain. So we don't want to muffle the pain so we can know
where. If I can interrupt you for a sec, that's even better, because a lot of patients notice that they miss a dose of gabapentin. So if you reduce it or you miss a dose and they come in here in higher pain and you can prove that the pain will reduce, then that's, again, amazing, especially with the money back guarantee. It's like a no-brainer, right?
Yes, absolutely. So again, you come in, we go through all of that. We'll sign the appropriate documentation, HIPAA, and all the consent forms. If you're a candidate, we feel you're ready to go forward. We will get your appointment booked maybe that same day if it works for you. Again, the appointment itself for the Scrambler is about an hour. We estimate 20 to 30 minutes to find the right location for the electrodes, and then 30 minutes you sit under with a sequencer. You can come in comfortable clothing. This is not anything that's going to be extravagant, just something that makes it easy to access the areas of the problem areas. So if it's your feet, some shoes that are easy to slip off, hands, and then of course anything along the core will be easy accessible. Again, won't take long. We get you your first session. We find within that first 5 to 10, 15 minutes of sequencing to know where the pain is and if you have relief. From there, we lock you in. If you know that it's working, we want you to get the absolute best results and continue on. We'll get you scheduled right there for your sequential sessions. And then after about session 10, let's fast forward to session 10 or, whatever your relief point is, where we finally have you completely graduated from the Scrambler therapy. What happens then? So now you're living with, if not significantly improved pain or maybe resolved pain, but you've been living in a world and a life that's been full of pain. Where do you go from there? What do you do? How do you embrace this new life? So we want to be there to walk you through that. We believe in whole body wellness. So your pain probably kept you from being as active, probably kept you from exercising, maybe having the best nutrition, maybe being as active in your life with the hobbies and events and picking up your grandkids or going on those adventures that you wanted to. So we want to help you get back into a life that is the healthiest and best life. That includes nutrition plan, an exercise program, or guidance and IV hydration to help you feel your best. And then, of course, mindset, because people who have had chronic pain, that's all they know. That's the hell they know. And so we want to help you, start with the mind and just heal a body from the inside out. And of course, we also have a very exciting skincare line that we'll be providing that now that you feel your best, you want to look your best. So we're there to help you through your journey of overcoming your chronic pain and then embracing your best life through nutrition and exercise and mindset and IV hydration and skincare.
Hey, if you look good, you feel good, right?
Absolutely.
So, all right. Well, thank you again for, taking time to inform patients and the community about this device that you had the foresight to kind of bring to Alaska. With our backgrounds, I'd be remiss if I didn't point out the Northern Lights because we're here in Alaska, but it also is a reminder that there is a light at the end of the tunnel. There's something that is there that can help you even when you feel like all hope is lost. This is a device that is very low risk to try. There's no implantable, there's no surgery, there's no needle, and you really don't have anything to lose but your pain. So I invite patients to come sign up today, and we look forward to seeing you soon and hopefully helping you to get out of pain and live a more painless life.
Yes. Yes, and we'll provide a link in this email that you can go to and get on my calendar. We will get you booked immediately for your one-on-one hour session of free consults just to discuss, again, everything. You bring your questions. Please, we love questions. And myself and Dr. Gay will be available to answer those questions. And just you're giving us the honor of serving you. So we look forward to seeing you.
Absolutely. All right. We'll see you soon. Take care.
All right. Thank you. Bye.